My name's Josephine Hindson and I am the Acting Allied Health Clinical Lead for Drug and Alcohol Clinical Services, and I'm based at James Fletcher Hospital. I've worked for H&E Drug and Alcohol Clinical Services for 15 years and I've always loved working in drug and alcohol. So I've been working in drug and alcohol for now 27 years and I've worked across Australia. And when I got the opportunity to work for H&E, I jumped at it because I thought that it's very evidence-based, there's a lot of support and the team was fabulous. So I knew that coming in, so that's why I came and worked for H&E. I am the Allied Health Clinical Lead for the district, so I support the allied health staff across the district, so up to Tamworth and Moree and Taree and Foster and down in Newcastle. So my role is to support their clinical practice and also support their education and their development. And the great thing about the team is that you have support from so many other people. So you've got your team itself, you've got the building here we're at, you can always go in next door or talk to people about a situation you're having or a clinical challenge that you're presented with. And then there's medical support, admin support, and then we've got the other support like the Aboriginal health workers and the peer workers that can all make the client journey as successful as possible, and always using evidence-based and education and support as well. We have entry-level positions and then we have more experienced positions. So we're obviously looking for people ideally with a qualification for the allied health staff or social work, psychology, OT, and so we want that. And depending what position it is, they could be entry-level, so they'd be in a team, so that can be with minimal experience. And obviously the people with more experience, we'd want them to be able to make clinical judgments on their own, especially if they're in an isolated position as well. We have a fabulous clinical nurse educator who organises monthly education sessions across the district, and that they're internal speakers and external speakers as well. We support education and support training, so we will provide time off work. There is a small fund for going to training as well, and we're always looking at new training opportunities, and we also provide clinical supervision to staff as well, so they can access supervision monthly. There's formal and informal supervision. So the formal supervision is provided monthly at a minimum to staff by either experienced drug and alcohol clinicians or senior clinicians, or we can do it external to other health providers within health, and that's monthly, that's supported so it's during work time. And then we also have the informal supervision, so if you're struggling with something with a client presentation, you can always go next door or come to me or to other, or medical, they're on call as well, so we can always get supervision about that client care at point of concern. I started in drug and alcohol 15 years ago as a caseworker at Newcastle Pharmacotherapy Service, and then I went to the cannabis clinic as a provisional psychologist. I did my 4+2 registration training there. I then went to my Masters of Clinical Psychology, so I'm an endorsed clinical psychologist, so that's where I come from, that background. I'm supported to go out, so I've been out to Tamworth once, I've been to Taree and Foster, and I'll be going out again a couple of times in the next couple of months, so we can meet with people. I can do rounding, allied health rounding with them. I also attend as many clinical reviews that I can that the teams have, so I'm on the teams meetings with them, and I will pop in and see if there's any clinical needs, so just trying to be as accessible as possible. I also send out a weekly email to the allied health staff, just updating them on training opportunities and other information that I think is relevant to their clinical practice as well as their professional development. The first thing I would do is always tell them to ring the manager who's advertising it and get some more information to see if it sort of fits with what they want to do and where their career wants to go. I would think about how it fits in with their career development and think about what they could offer to drug and alcohol as well, and how their experience would go in this position. When I was working at the cannabis clinic, it was a mixture of client care, so you'd see up to 4 clients a day, and these can be quite complex clients as well with complex presentations. You might have a clinical review meeting during that time, you would have team meetings, you would have time to debrief with your colleagues, you'd have a lunch break, and you can have a project as well. So I know we're part of research as well, so the team's looking at EMDR and bringing EMDR into the service as well. And I think The benefit of drug and alcohol is that you actually get to do therapeutic interventions, and so you can see a client and can see the progress that they make through that journey. It's lovely. There's so many teams here. They're all really supportive. So, you can have those impromptu meetings about a client to get multidisciplinary input. It's a fun team. There's always laughter. Even though that we're working with some really challenging and complex issues, that we're always really supportive of each other, and we can have a bit of downtime and we can have a chat about things. But yeah, it's very supportive. We'll have Friday lunches. People might go for drinks after work. But yeah, very supportive. And having this courtyard that we're sitting in now, people congregate here for lunch a lot as well. So it's very good. And our admin's amazing and very supportive as well.